It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we have in the studio my partner in all things, Tacey. Hello, Tacey.
Hello.
And back from sabbatical, it's NP Mel B. Hello.
Hello.
This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. So welcome, everyone. Good to see you. Don't forget Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. 'Tis the season for CBD nasal spray, apparently.
Yes, it is. Yes, it is.
Oh, good. Good deal. All right. So, NP Melby, you haven't been here for a while.
No, haven't.
And people listening to you may notice that your voice sounds a little different.
Yes, I don't have the raspy.
You don't have the
Smoker's voice,
the sexy voice anymore.
masturbated
It's
doll
gone.
voice from the crazy old lady from my initial encounter, or from the Andy Griffith Fun Girls.
Yes.
Yeah,
that, yeah.
hello, Bernie, and then the other one, hello, doll.
Yes, all gone.
Yeah.
All gone.
So what happened? What's going on?
Well, I had a very large thyroid nodule that just kept growing, and it was compressing my vocal cords, and it is now gone.
They
That
removed
and-
it surgically.
They did, and my entire thyroid with it.
Oh, is that right?
Yes, the whole
Okay,
thing.
so I'm displaying for the people who are watching live, they can see the picture. If you want to see it, you can go to youtube.com/@weirdmedicine and see what looks like a big, looks like sweetbreads. I guess it actually is sweetbreads.
So gross.
Well, it is. I mean, sweetbread is thymus gland, right?
It looks like barbecue chicken.
Yeah.
Oh, that's gross too.
So the two lobes in this thing is the thyroid, I'm assuming, and then the
Right.
big thing in the lower right-hand corner is the nodule itself.
That is the very large mass.
So what was the pathology of the mass?
Not cancer, so
Yay.
that's great.
Okay, excellent.
It was some type of cyst that just kept getting bigger.
Really?
Yes, and kept growing for whatever reason.
So you had it removed, and tell us about that procedure.
Well, just surgical procedure. They cut across my neck, right where my collarbone is.
Yeah.
Right there in that notch.
Okay.
Got a scar, a couple inches across there, and they just cut into it. They removed both lobes of my thyroid and that tumor. And that mass that was there was about almost 8 centimeters.
Wow.
So it was pretty big.
It looks huge.
Yeah, about the size of a baseball.
Is it the North American record, I wonder?
Not quite.
So
Probably
now,
not.
so now you have to be on medication the rest of your
Yes,
life?
With my thyroid gone, I have to have thyroid replacement.
Really?
So we're still working on getting that adjusted.
Yeah, talk to Tacey about that. She's
It is a nightmare.
It is a
an
nightmare.
ongoing thing. It's like you feel good, and then they take blood, and they make an adjustment, and then you don't feel so good.
Mm-hmm.
Yeah, and what Tacey's run into is that they tend to treat you based on numbers on a piece of paper.
They do. They treat based on your TSH level, and that's not always
Right.
reflective of how you feel.
Correct. And we've learned that treating just based on numbers is fraught with all kinds of problems because the numbers themselves are suspect. If you take a sample of 1,000 people And I just wonder how many people are undiagnosed with thyroid disease in this country.
A bunch, I would think.
Yeah, so you're including them in the normal.
Just walking around feeling like shit.
Yeah, feeling like shit.
And
Nobody can
that's
figure out why.
so you take 1,000 people, you get the mean, and then you go 2 standard deviations from the mean, and you call that normal. But what if there's a significant fraction of people that are low, and they're skewing those numbers down, so that normal looks normal when it really shouldn't be normal. We see this with testosterone all the time, where there's it's estimated to be upward of 90% of men who have low testosterone don't know it. So they'll end up in that sample of quote unquote normal. So, then you have the problem of people that are absolutely symptomatic. Going to their doctor, they do the lab work and said, well, your number's 350. That's normal. It's low normal, but it's considered normal, but it's not normal. Right. If you talk to any men's health or urologists that know anything about it, they say, your number should be 500 to 800.
Well, and I've got a question
to be
about
not symptomatic, and it's the same thing with thyroid.
Yeah,
and I've got a question about because we see that so much with testosterone and certainly thyroids, but are there tests run in adolescence, let's say, or even young adulthood, just to get baselines? As a general rule, there are not. Are they typically like if you went in for just a normal physical as a 21-year-old, they're not necessarily going to check your thyroid or your testosterone if you're feeling normal.
And I think
not usually.
You know what I mean. But I just wonder if you should.
Yeah.
At an earlier age,
just
so you get a baseline, so that when you're 45 and you're feeling like shit, and they go, "Well, your testosterone's 350, you're normal." You're like, "Wait a minute."
Oh, I see what you're saying.
When
I
was
your own control.
Correct. Yeah. So when you're 21 years old, you can say, "Look, dude, when I was 21, my testosterone was 600."
Oh, for fuck's sake!
Yes.
I like that idea. No, it's a good idea.
It is a good idea, but
to do a baseline,
it'd be simple. It's a really simple, inexpensive test.
It is.
It isn't until patients go to the doctor and they start complaining about fatigue and
that they start drawing
unexplained depression.
Right. And then they say,
weight gain and hair loss and things like that.
It's normal. We can't treat it. We're not going to treat it. It's got to be something else.
How many people, men, do we have that tell us that they have fatigue, physical weakness, muscle weakness, loss of libido, loss of libido. What did I say? Loss of libido.
Living libido.
Low libido. Yeah,
living libido.
Living libido loca. So, and erectile dysfunction, and then they go to their doctor, and the testosterone is 350, and they just say, "No, you're normal," and it's asinine.
Yeah, it's
this is incorrect. That's bad medicine. And
you got to listen to your patients.
And if you are listening to me and you have this, right, thank you. You have to listen to your patients.
Give thyself
for fuck's sake.
My first bill.
Tacy's, she shut out so far.
No. Well, you'll get yours when you do Tacy's Time of Topics.
Oh, will I, though? Oh, that's interesting, since someone threw mine away.
Since somebody threw yours away from 2 weeks ago?
Yes.
When they cleaned the studio?
Yes, they were laying right here where I sit. I do not trash your stuff.
That'd be a terrible idea.
Yeah. And it had topics that had already been done on there, right?
No.
That you had done some of them? Because I saw that and I purposely threw it away. It's like, well, we don't need this. And that was 2 weeks ago.
There you go.
So
no bills for you.
Oh, I see how this is getting turned around. You throw it away, but it's my fault.
There you go.
Yeah.
Isn't that the way
you
this
left
works?
it there. Anyway,
so I could use it next time.
Well, you're just so used to me never cleaning the studio. That was the aberration. Is I cleaned the studio, and I've got we have our new sign up here and
which
stuff,
is beautiful.
Which no one can see. But let me see. I think they can see.
I
it.
can see a little bit.
Over my head, you can a little bit.
Yeah.
And it is very clean
very
in here
nice.
since the last time I was here.
I still have a ways to
Not
go, and I'm
still.
just these can't. It doesn't matter. Nobody who's listening on the radio cares, but I'm moving the cameras around. That thing is going over here, and so that we can actually see it, because over Scott's head, it's not. It's a little bit visible, but I want to. have one camera that just zooms in on that, so that's what we're showing at the beginning. But anyway, like I said, that's just for. We don't even do a visual aspect of the show, really. But now I'm kind of getting obsessed with doing it properly, But anyway, all right.
So I'm not on TV right now?
No,
I'm not on
no one
camera?
can see you.
I did my makeup and hair and everything.
Oh, I'm sorry. Well, you can stand up and wave at the camera.
No, I'm good.
The cameras are all behind you. A lot of our guests don't want to be on camera, so I kind of did that on purpose. But,
I actually put makeup on today too.
well,
And you look
we can
fantastic.
Why,
see.
thank you.
Gorgeous.
Yeah, we can see. just
Okay, now
fine.
I'll suck my gut in.
Okay. Yeah,
Boobies out, gut sucked
there you
in.
go.
Chest up.
I'll let
chin
you know
up.
when your camera's on, Tace.
Phew, that's
Okay,
hard.
camera's off, Tace. You
So
can
it's
relax.
really
But-
a lot of work to sit like that. For a
Talking
long time.
about
No one cares about any of this. All right, go ahead.
thyroid and
Yes.
all that other stuff.
Yep.
I mean, how many years did you feel like complete and utter shit before you were diagnosed?
So
Well, before
the
anybody paid
nodule
attention
we've
to you.
known has been there for at least 6-7 years, and it was tiny, just like a few
That's
centimeters.
how mine is,
like
yeah.
tiny, like I think 2 centimeters. And then over about a year, it more than doubled in size.
But before you were diagnosed with Hashimoto's or whatever, how long did you think
I
or
have
know something
felt
was wrong?
my TSH has always been quote unquote normal. So normal being like 0.5-ish to about 4-ish. It's always been in the normal range. But I felt bad for years. I have a
Yes,
lot
me
of
too.
joint pain, a lot of aches and pains, just feeling tired, really fatigued all the time. My hair's been falling out for like ever. I just figured it's because I was getting old. But just little symptoms like that. So I've got some other autoimmune issues,
Yeah.
definitely. So they've just been treating that, but never with thyroid replacement, never with levothyroxine or Synthroid. And then February of last year, they checked the nodule. It had more than doubled in size. It was about 4 centimeters at that point.
They felt it, or they did an ultrasound.
They did an ultrasound
Okay.
as part of, because they monitor it for every year for
Okay.
several years now. So it was about 4 centimeters. They finally decided because of the hoarseness, the increase in symptoms I was having, and just really completely felt like shit. Been gaining weight. Probably about 30 pounds in the last couple of years. Just not feeling like exercising anything. So, referred me to a surgeon. Finally had the mass taken out.
Yeah.
And the thyroidectomy in the end of June.
Wow.
So, and it got postponed because of some other health issues with my family. So I got that done in June. And since then, I feel fantastic.
Yeah, you look.
Good.
This is
You
the
look like
best.
$1 million.
Yeah, this is the best I've felt in probably close to 10 years.
I
Yeah.
want mine out.
I've lost 27 pounds.
Yay.
I have energy. The minor, just kind of, I guess, depression I felt, just feeling blah, not wanting to get up, didn't
Yeah.
want to get out of bed, didn't want to exercise,
Yeah.
wasn't in the mood, just tired all the time. I feel so much better. I
good.
exercise most every day. I walk 2 to 3, sometimes 4 miles a day.
But you had to advocate for yourself.
I
for
did.
Years.
And when the
And
ultrasound
can you
came
imagine
back at
people
4
just go,
centimeters.
They said I'm normal. I guess this is just my life.
Yeah. So when it was 4 centimeters, my physician initially said, "Well, let's get another biopsy." I've already had it biopsied twice, which was
Now,
no
what did your
fun.
biopsy say?
One indicated
You're normal.
Hashimoto's, but the rest of them just said non-cancerous.
See, mine said actually lymphoma.
What?
Yes, and so then, and so that doctor said they wanted it out, but then 2 other doctors were like, no, thyroid cancer won't kill you. So I don't know where I am in this whole spot. That is
Like-
exactly what happened, Steve.
Okay. Okay.
No, I mean, we believe you. It's
I
just-
saw you
it's hard-
shake your head.
No, he was
no,
looking
no,
at
no,
me.
no, I was looking at him. Yeah.
Yeah.
I thought that's a crazy thing to say.
Yeah. Well, when my doctor suggested another biopsy,
reacting
I
to
said
you.
no.
I
No,
was
it me,
reacting to
swear.
him.
It was me, I swear.
But I said no, and I said, let's maybe go talk to a surgeon.
Yeah.
And because of the symptoms, I was having a lot of hoarseness. If I turned my head to the left, my voice would totally go away.
Well, my God, it was huge.
And I was starting to have a lot of trouble swallowing food and
I bet.
things. So the surgeon was immediately like, yeah, let's take it out. Gave me an option of a partial thyroidectomy and just take the tumor. It was on the left side. So they were going to take the mass and the left side of my thyroid. If it came back cancerous, they would likely have to go in and do the other side. So that was some conversation that you and I had.
Yes.
And we talked about whether or not to do a complete thyroidectomy.
Yeah.
And we talked about, it was like a scale that you had me do. And I can't remember what it was called.
I don't even remember.
But we talked about the pros and cons of both.
Yeah.
And I decided the deciding factor for me is I did not want to have this surgery done more than once in
Right.
the lab because it is not
'Cause you
pleasant.
knew it was gonna happen
not
again.
pleasant.
Yeah.
And just with family history and things, I decided to go ahead and have the whole thing done. I'm glad I did
Yeah.
because I
Yay.
feel like $1 million.
Yeah,
Well,
good.
that's awesome.
So still don't exactly have my levels where it needs to be. So most women usually feel better when their thyroid is somewhere between about 0.2 to 0.4 and less than about 2.5. And so that's my goal, is to get my thyroid levels.
When you say your
down
thyroid,
there.
you mean the TSH?
The
or
TSH levels,
okay,
yes.
The thyroid stimulating hormone. So
So
that'll be high when your thyroid is low and low when your thyroid
it's
is high. And
backwards,
then,
yes.
yeah.
So when I first had the surgery, they put me on levothyroxine, which is the thyroid replacement. And about 6 weeks later, they checked my blood work, and my TSH was extremely low. It was like 0.2. And the doctor said, no, that's too much medicine, and they lowered my medication. Well, at the time, I felt great.
Right.
And wonderful. I had energy.
The one time
it was
you
like
felt
the
good, they're
Energizer
like,
Bunny.
Now we got to change everything.
Yes. So they lowered my medication, and I went back down and into a little bit of a slump. Still feeling better than I did before the surgery, than I did this time last year.
Yeah.
After another 6 weeks, my TSH levels went up to 8 point something.
Okay.
So it was like the other extreme, and they put me back on the previous dose. So just had my thyroid checked last week. My TSH is down to 3.8, I believe, which is not where I want it. I do feel better.
If
but
you were feeling good, for the medical students and people out there, and the reason we're going on and on and on about this is because there are a lot of people out there that have this same sort of thing.
It's important.
And you need to advocate for yourself. But what they should have done when you get an abnormal lab test is you repeat the fucking thing. You don't just react to it. So when you had a low TSH, because you've already seen, they went down and then they overshot, and now they went back to the dose they were at, and it's 3. It's not 0.2 now.
Right.
So what's different? The difference is all they needed to do was give you 2 weeks and
Just
recheck it. So always, if you get an unexpected abnormal result, just recheck it before you just go knee jerking and doing things. Because really, what they did was they allowed you to be miserable again for a little while.
Right. So we're researching as to whether or not, because levothyroxine, is a T4 replacement,
Correct.
which is long acting.
Then there's liothyronine, which is the T3.
T3. So there's lots of studies that say there's no benefit to doing
Correct.
T3 replacement.
But what the hell?
Yeah.
You're
so
on
we're-
liothyronine, aren't you, Tace?
And
Yes.
Synthroid, yes.
So we are looking. I talked with my doctor about adjusting my dose a little bit to increase my levothyroxine just a little bit by about 100 micrograms a week, divided into small doses.
See, now you have the knowledge
to add
to do
to
this. Can you-
what I've got, and then versus trying what's the medicine, the
liothyronine,
T3, the T3 replacement, and starting with just a low dose of that to see if it makes me feel any better.
So you can go in there and negotiate this. Can you imagine if
Oh,
you're like a musician or an artist or just somebody that has no medical knowledge?
Right.
What are they supposed to do?
I told my doctor when I saw him this week, I said, I'm not leaving here unless we are doing something. I know the blood work says I'm
Yeah.
good where I'm at, but I don't feel
But I'm
as
calling
good as I could.
shenanigans. Stacey, tell them
Yeah.
about your experience. You left
I got up
endocrinologist and never went back.
In the middle of the consult, I got up and just walked out.
Oh, wow.
Because?
He said, don't let the depression get you down. And I knew it was my thyroid. I just knew it. Man, I just felt, and I just got up when he said that and got my bag and just walked out.
Yeah.
Well, depression is a thing. It can be situational. Things can happen in our life that'll make us feel depressed. It can be chemical and things going on in our body that can make us depressed. And we kind of know the difference.
I was not depressed. I was psycho. Psycho with a slash of depression. I mean, I was fucking crazy.
I call that knucking futs.
Yes, that's how I was, and it wasn't. It wasn't just your typical old depression, because I've had that before. I knew what that was. This was different.
No.
And he was not listening to me, and
All you medical students out there, listen to your patients.
yes.
So luckily, I have a great doctor who listens to me, and he gave me some options. And
Oh, you're so welcome.
Yeah.
Darth
Yeah.
Nuggs earlier was saying, when you guys were talking about tennis shoes, he's like two hillbilly yentas talking about tennis shoes. Now we're hillbilly yentas talking about our thyroids. It's okay.
Hey, I make the residents that I train come through take a listening skills test.
oh, very
And it's
important.
it's a 25 question test. I got it from a book.
Really?
Yeah.
How do you test listening skills?
I found I was accused by my special lady friend of not being a good listener,
Okay, so let's hear it.
and I said that's categorically
I
false.
want this.
That's
Send this to
categorically
me.
false.
I want to share it with my students.
And I said, and I said, and I'm going to prove it, because if I'm a bad listener, I want to know
You
why.
want to be better.
Right.
I want to be better, because I'm all about, if I'm bad at something, I want to be better. I said, I'm going to find me a book. So I found this book called The Zen of Listening, and it's a psychologist in California, and she does research on listening skills. So I'm reading the first half of this book, and in the middle of the book is a quiz, and it says, take this quiz honestly, and I did. And the whole time I'm taking it, I'm like, oh my God, she's right. I'm the worst listener ever. And max scores 25, and I had 21. And to this day,
Meaning higher
Wait,
is
25
bad.
is bad?
No, 25 is perfect.
perfect.
Yeah, 21.
And you were only a 21?
Right.
As a man, that's impressive.
It's insane. And I've not had a single resident even over 15. And I made everybody my staff, I made all my staff take it. One of them made it to double digits. And I
Yeah.
said, that's why
And not your girlfriend.
not my special lady friend. she I think she pulled in a solid 9. I hope she's not listening
Well,
now.
let's hear this test. Here's the test.
But this is true, yeah.
I want it, yes.
That's an excellent.
I perform another task while listening to someone talk about something upsetting to them. So that would be like folding laundry, skimming an article, cooking, watching TV, etc. Always, often, sometimes, rarely, or never. Now, if it's something that's upsetting to somebody, I'm not doing anything.
Yeah, if it's
But
upsetting to
if
them.
Tacey's just talking about her day, I'm cooking, because that's when we talk.
Yeah.
So I'll put sometimes on that.
I had a
one.
flat
If we
tire.
can
I had a flat
exclude-
tire today, Steve. Oh, that's great, honey. Would you like some ketchup with your French fries?
I daydream while listening to someone express his or her thoughts or ideas. No.
Always.
You're in always on that?
Nope.
My mind never stops.
Yeah,
I'm
that's
always
why
thinking
we have
about
to become
something.
more zen. This is
I will stop a speaker
Mindfulness,
in
right.
mid-sentence to interject my opinion. If I disagree with a statement he has made, I'll say yes on that one. Well, I just don't have time. I don't have time to listen to bullshit.
Yep.
So then I need to work on that.
Well, there's a difference between bullshit and somebody that you just disagree with.
Well, and
Yeah.
it's and to them it's not bullshit though. That's
No.
that's the thing.
When I listen to a speaker, I make eye contact, yes.
course.
I nod
Oh,
my
yeah.
head in agreement with the speaker is saying, yes. I'm not sure whether I've grasped a speaker's point correctly. I summarize my understanding of what he or she has said to confirm that I've got it right.
Yes.
Well, somebody.
What do you think about that one, Taste? Do I do that?
I wasn't listening.
Yeah, okay. She's a zero. If the
can you
speaker doesn't
email that to
engage
me?
my interest, my mind wanders.
I will. I'll text to you.
Thank you.
What's that? Yeah, I got it. I'll send it to you.
Yeah.
I shift in my chair or tap my feet when I listen to other people speaking.
I do that all the time.
I do
you?
that.
Okay.
I'm bad about that. Well, that's just my body wants to do it.
Yeah, I think it's anxiety, though.
Yeah.
I can't sit still.
I make disapproving faces when I don't approve of what others are telling me.
Yes.
Well, that's a sign of good listening.
Only when Robin's talking to me do it.
Aw.
Oh, for God's sake.
You're in trouble.
Oh, no, like I said, I don't think she's listening today.
If a speaker mispronounces a word, I immediately correct him or her. Now, come on, that's my job. When Scott says islet cells, that's hilarious.
Do you enjoy when you
Damn
correct your
I only
friends?
do that to my kids. They always come up with the best words.
Go to next questions, okay? Oh, God, there are a lot of them, aren't there?
Yeah, it was 25.
Okay.
Yeah.
Okay, I wait for a speaker to finish his or her point before I make a mental judgment call on what was said. I'm going to say sometimes on that one. If a person feels the need to vent his or her emotions to me, I wait till they let it all out before I comment. I audibly groan or make another kind of disapproving sound when someone states something I agree with.
You
That would
better
be-
say always.
Me?
Yeah.
Yeah.
I do?
Yeah.
Yeah.
Fuck
Oh,
off.
God, he does. He's the worst.
Fuck off. I hate all
Yes,
of
You
you.
make all kinds of noise.
Do I?
Yeah, a little
Hey,
bit.
listen,
I gotta
we'll be,
do better.
we'll be playing music, and I'll hit like a wrong note, and I can hear him go. I'm like, I didn't do it
When we're on the
purpose.
phone and I'm presenting a problem and I need advice and opinion and talk through something, I always know when I need to speed it up
Yep.
because you start making noise. Like,
Sorry. Well, usually what it is I'm fussing at the person that you're talking about, not at you. And that is something I got to work on because I've always had to work on it. You know, someone will tell me something. Well, that person is like, and I'm like, "Grr," and they think I'm mad at them, but my ire is at the person that they're talking about. But okay, I interrupt when I have something to add. Yeah, I do that. When listening, I make sure I'm facing the speaker. I do that.
yes.
I'll interrupt a serious discussion to take a personal call. Fuck off.
How many times?
If you're on call, you have to.
That's only happened
yeah.
once.
I finish other people's
Yes,
sentences
exactly.
before they have a chance to. Okay, let me see. Yeah, y'all,
You have an
I'm
important
not sure.
job. You
I'm
have
not-
to be available.
I'm not sure good listening is a skill we need to be worried about.
Maybe we shouldn't be talking
No,
about
I was going to say, he's going to take my bell away. He's going to de-bell me.
Yeah, I don't like the song and dance. It says I act impatient when someone beats around the bush.
Yep.
Yeah, it's
Yeah.
like I don't need the song and dance.
Yep.
He actually said that to me. Was it yesterday or the day before when we were furniture shopping? I was explaining why we needed.
Oh no,
new
no, no! I
furniture.
said they don't.
They
need
don't
the song
need
and
the
dance.
song and
Well,
dance,
We were gonna
Tassie.
buy furniture. Well, there's people she works with, so it was a joke. And she was like, "Well," and we had the lizard in that room, and now we're gonna clean the walls, and we're gonna do
Oh,
this
my
and that. And it's
God.
like, okay, they don't need the song and dance. Let's just buy it. I was trying to be funny, but of course I failed.
Well, that's because you're an idiot.
All right. Okay. No.
So what'd you score?
I'm still. This one's got.
Are you still taking it?
Yes, there's more. When listening to a speaker, I pay close attention to his or her body language. That I do.
Yes.
Good God, this is 30 questions. When a conversation turns to a subject I find harder to understand, I do pay close attention to see if I can learn something. For me, listening is an active process. I do think so. Well, for what? Oh, okay, there's more. Let me see.
Well, nobody else is listening.
I know. Okay.
Everyone else has quit
They're
listening
tapping
to
their
him.
feet and
Weird
rolling their
medicine.
eyes and grunting.
Okay, I'm just gonna do the next ones. Okay. So, okay, I've scored a 43, so it's a completely different scale. What a waste of time.
Well, 43 is probably good.
You're a good listener.
It says when you're interacting with others, want to add a word in edgeways or simply want to move the conversation along, it can be a challenge for you to sit quietly and wait. You have some degree of patience, but it's limited. I'd say this is probably true. This is simply a trait that needs to be developed further. When you're not feeling particularly patient, it could potentially result in interrupting or difficulty being fully attentive, which can disrupt the flow of a conversation. In order to keep the interactions with others harmonious, it's important that you strive to improve in this area. Okay.
There you go.
Yeah, not so great for a radio host, but in my real life, yeah, I'll put this this link in the chat and in our what do you call it in our
Fluid family.
Fluid family, but also on the
Love
YouTube
that
channel.
word,
yeah.
Fluid.
Yeah, but I think the most important thing is if people take the test and read the next part of the book, which tells you how to improve on where your skills are lacking, which is what I did. And I think Steve and I have a couple of the similar lacking skills, which is, I'm notorious for saying, listen, I don't want the whole story. Get to the end of the story.
Yeah,
I don't
Give me
need
the highlights.
Yeah, I don't need.
Well,
the
and
whole thing. Just
if
get
you're
to
on
there.
call and you have somebody calling you and saying, well, they have the nicest little dog and he's always licking my hand, and all of a sudden it's like, okay, it's 2 a.m.
Get to the point.
Can you just and then it's always like, well, I need a refill on Roxanol or something. It's like, you could have just called me and said, I need a refill of Roxanol. And I hate to be a dick.
Yeah.
I really don't like it because it bothers me afterward, and I ruminate about it, and I'm always worried that I've offended somebody, and it keeps me up at night. But it's like, how can you at 2 o'clock in the morning call somebody, and then you don't know? Well, how much have they taken? Well, I don't know. It's like, how do you not know?
Have all
Oh
the
my
information.
God!
Well,
So
all I know
anyway,
is the bottle's empty.
all right.
Didn't you win an award for being the best doctor to wake up at 2 o'clock in the morning?
Yes.
Awesome.
That's
I
because he doesn't wake up at 2 a.m. He's not gone to
It's not
sleep.
me.
He's not gone to
Oh,
sleep.
well, that
yet.
may be it. Yeah, that is.
You're still awake.
I'm still awake.
probably true.
No.
Okay, let's move on to something that's sad to me,
Entertaining.
which is,
Oh,
it's
no.
sad.
Sad.
It's Matthew Perry.
yeah,
So we are
okay.
recording this on December 16th.
Yep.
And some people will be listening to it much later, but Matthew Perry died of acute effects of ketamine, the autopsy says. Now, the reason I bring this up is because I've been extolling the virtues of ketamine on this show, and a bunch of people have been tweeting this at me. Well, Steve, be careful, be careful. Well, okay, so you got to hear the whole story, though.
Yeah.
So he drowned, and he had a high dose of ketamine in his body. And he was found unresponsive in the hot tub in his home in Los Angeles. And the drowning, coronary artery disease, and the effect of buprenorphine had contributed to his death. But then the autopsy ascribed his death primarily to acute effects of ketamine. Now, ketamine is a powerful anesthetic, and it has become increasingly popular as an alternative therapy for depression, anxiety, post-traumatic stress disorder, and other hard-to-treat mental health problems, but it's also used recreationally. Now, he had gotten a ketamine infusion, but it was 10 days before. Now, the half-life is like 4 hours, so it was out of his system. This had nothing to do with the therapeutic ketamine infusion that he had. He had high levels of ketamine in his postmortem blood specimens, and so what they think happened was that he ingested ketamine on his own. Whether it was prescribed or not, we do not know. But he had high levels of ketamine in his system, and then he was in a hot tub. And he dozed off and didn't wake up when he started drowning.
Yeah. And did it say how much Suboxone he was on?
No. Well, it doesn't say anything about that. It's just talking about that. It says he
bloodstream.
played pickleball at 11 a.m. His assistant left the home to run errands at 1:37 p.m. And at 4 p.m., they found him floating face down. And, it's sad because I always really liked him. I never watched Friends, but I liked him in other stuff I saw him in, that Studio 66. He was amazing in that.
Right.
And he was just so personable. And the fact that he had these demons you just didn't know. You couldn't tell from the art. At least I couldn't. And, it was, it's just terrible. But two things. I have people that come to me that don't want to take fentanyl for their cancer pain because they've seen stories about fentanyl deaths in the news. Well, there's one thing about taking something under the supervision of a of a provider, licensed provider, and another thing of taking something that's off the street and you don't know what's in it, and et cetera, et cetera. So I have to have that explanation. Same thing here. I don't know what he did, but it wasn't the ketamine infusion that was done under the supervision of a healthcare provider that caused his demise. It was taking it outside of that therapeutic environment. And if you're going to take, and even if he was taking a prescribed amount of ketamine, he had to know the effects that it has on you.
Yeah.
I don't get in water that can cover your mouth and nose.
Yep.
That's 6 inches. Don't get in 6 inches of water if you're taking any drug
Like
that can sedate you.
benzodiazepines,
Xanax,
Mm-hmm.
lorazepam,
Alcohol.
Ambien,
Any of those things.
Ambien.
Ambien, that's a good one.
Sleep things. Don't take that and get in a hot tub.
right, or a
Or any
pool,
kind, or swim pool,
or
yeah.
take a bath.
Yeah.
I mean, that's what happened to Whitney Houston. She was taking a bath, and she dozed off or passed out, and I mean, apparently, allegedly, that's what happened, and she drowned.
Yep.
So, we do not have good defenses against drowning when we are unconscious. Well, we don't have good defenses against anything.
No.
But that urge to breathe is great until your body can't, make you conscious again. It's very hard to drown yourself, but if you're taking a drug that causes you to be completely sedated, it can happen. So please don't do that. We don't need to lose any more people of, famous or not, through drowning because they were taking a sedating drug and they got in water. Okay? Please. I know it feels good.
Yeah.
And it feels like it's going to feel good, but you've got to set that boundary up front.
Yep.
All right? And never allow yourself to do that. Okie doke. Anybody have any stories? Did you bring one, Mel B? Well, you brought your thyroid.
I brought my
that's enough.
thyroid with me.
Okay, and Tacey's stuff got thrown away. So let's do some questions then. You got any questions from the Fluid family before I do
Not
this?
yet.
Okay.
Number one thing, don't take advice from some asshole on the radio.
All right. Let's try this one here. What sayest thou? Oh, boy. Here we go.
Hi, Dr. Steve.
Hey.
Calling about kidney stones.
Okay.
I don't have them, thank goodness, but I was just wondering.
Yeah.
So kidney stones are made up mostly of calcium.
Well,
Is there anything we can do?
it depends. Kidney stones can be calcium stones. They can be uric acid stones. They can be oxalate stones. There's all kinds of things that can be, in a kidney stone. So
Due to just the thought of it makes me hurt and
Yeah.
cross my legs. So is there anything that we can do to prevent them from ever coming? I understand that drinking, I think it was my neighbor who said drinking tons of iced tea made from like a powdered mix caused him to have kidney stones. But if it's calcium, it seems like milk would be a big, reason why you get kidney stones. I don't drink milk, thankfully. But is there anything that I can do that will prevent, or that, not me, but that we can do that will prevent maybe
well, sure.
from having kidney stones?
Yeah, absolutely. So it sounds like he's never had one. He's just worried about getting one. If you've never had one, it is kind of unlikely that, every day that you go where you haven't formed a kidney stone, it's less likely that you're going to.
Right.
But there's always a first time. So staying well hydrated. What do you think, Mel B? It looks like you want to say something.
No, I'm just laughing.
Oh, you're just laughing. Okay. Well, no. So
I was going to suggest sitting cross-legged
yes.
5 times a day for 3 minutes.
Really? To prevent kidney stones?
I just might give this guy something to do.
Oh, okay. Give him something to do to think about something else. Yeah.
Yeah.
Yeah. I remember.
Drink lots and lots of water.
Yes.
Cranberry juice is good. Just kind of flush things out a little bit.
Well, what causes kidney stones?
Well, it depends,
depends.
doesn't it?
Yeah.
So if you have high uric acid and you've got the wrong pH in your urine, you will form kidney stones. And as a matter of fact, there's a drug that we use to help people excrete more uric acid called probenecid. And if you just give that to people, they're going to start peeing out massive amounts of uric acid, and they'll make kidney stones almost every time. But if you give them potassium citrate to change the pH of their urine, they will not. So if you have uric acid stones, if you have gout, and you're making stones, you can put people on potassium citrate to prevent them. You can, tea can cause kidney stones if you are prone to make kidney stones. But green tea looks like it won't. It actually prevents kidney stones from being formed. So, but it just really depends. Some kidney stones will form in an acidic environment, some in a basic environment. So you have to know what kind of stones you have. So if you have a kidney stone, make sure that they take it and analyze it. Then they can put you on a diet or give you a medication to help prevent the stones. Now, if you just want to generally prevent kidney stones, do what NP Mel B said: drink lots of water,
Lots and lots of water.
stay well hydrated, and it looks like maybe green tea might be beneficial in preventing kidney stones in general. All cause kidney stones. So you could try that, and then just go from there.
Yeah,
And
lay off the sodas.
And right, and there are other things to worry about, but you get these things in your head. Our kid, when he was 10 or 8, he thought he was going to get rabies. I don't know where he heard about it, but every night he would call me in there and say, "Can you get rabies from petting a cat?" And it's like, "Nope, you can't get rabies. You do not have rabies." And then he would, what were some of the other things? It was always about rabies, though. He was worried about getting rabies.
Yeah.
And I don't know where it came from. He learned about it in school or something. I remember when I was a kid, rabies was like terrifying. They used to have commercials about not petting wild dogs and stuff before they had rabies vaccine. And I remember this horrible. I was 4 years old. I remember this like it was yesterday. I'm watching the TV and they're doing an anti-rabies commercial, and this guy's walking down the stairs, and all of a sudden he starts having seizures and foaming at the mouth, and the screen is flashing. Boom, 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 boom. I remember the sound of it. It scared the ever-living shit out of me. And we have a friend that's from India, and they in her area didn't have rabies vaccine. Dogs that you didn't know were monsters to them. And when she would see our dogs, she would freak out.
She won't come into the house.
So we had to put them in a thing, so we go to their house now.
When I worked at the health department, we always got calls about rabies.
Yeah.
People, I had a bat in my house. What do I do?
Yeah.
Go to the emergency room. Tell them, and they'll give you the rabies vaccine. This woman did not want to go. So we just told her, well, if you get rabies, you will surely die.
Yep, that's true. Rabies, it's about 100%.
Is it like a bunch of shots in the stomach?
It used to be you had to get an intraperitoneal shot, but now I don't think that's the case.
I'm not sure how to do it now.
Rabies vaccine.
It's not a pleasant treatment, but rabies is not pleasant
either.
And again, you will surely die.
Yeah.
2 IM doses now. It says, okay, so a regimen of 4, now wait a minute. Regimen of 4 1 ml doses of vaccine should be administered intramuscularly to previously unvaccinated person. The first dose of the 4-dose course should be administered as soon as possible after exposure. Additional doses should be administered at days 3, 7, and 14 after the first vaccination. For adults, the vaccine should always be administered into the muscle in the deltoid area of the arm. For children, they do it in the thigh as acceptable. The gluteal area, in other words, ass cheek, should never be used because observations suggest administration in this area results in lower neutralizing antibody titers. It's because Americans have fat asses, and it doesn't end up in the muscle. It ends up in the fat.
Yep.
So, post-exposure prophylaxis, wound cleansing. All post-exposure prophylaxis should begin with immediate thorough cleansing, and then a full dose should be infiltrated around any wounds. This is rabies immunoglobulin. So these are antibodies against rabies.
Okay.
And they're saying you give a full dose around any wounds, and any remaining volume should be administered IM at the anatomic site distant from the vaccine administration. So what they're doing is they're injecting you with antibodies that were generated, in a vat or whatever by monoclonal, cells, and to mop up any viruses that are laying around because you don't have any antibodies.
Right.
And then the vaccine, and it says 1 ml, one each on days 0, 3, 7, and 14. Now I remember when I was a kid. When they finally came out with the rabies vaccine, it was intraperitoneal. You had to actually give it shots into the abdomen. I think that's what you're thinking about.
Yeah. Mm-hmm. And it was like 20-something or some crazy amount. It was very scary.
If you get bit again after you've been vaccinated, you don't have to do the rabies immunoglobulin. You do all the other stuff. And then the vaccine is just 2 days.
That's just bad luck.
Yeah. Well,
exposed again.
Yeah,
sure, but wildlife officers and stuff, they get called to deal with rabid animals. We had a rabid skunk in my parking lot when I was in rural Tennessee practicing. We had to get them out there to get it. So those people get bit. Anyway,
how could you tell it was rabid?
Well,
was it foaming at the mouth?
It was stumbling around during the day in our parking lot.
I'm surprised one of your nurses just didn't go get a gun and
Those
shoot
things
it.
are
I know. They would have.
Exactly. That's the point.
Anyway, yeah, very interesting.
It's wild.
Old rabies. Well, we don't have to worry about that so much,
Well,
although it still happens. Yep.
And hopefully this guy won't get kidney stones.
Right.
Yes.
Good luck, buddy.
Good luck, buddy.
Yep. You just worry about stuff.
I understand.
Sometimes
the
you get it in
fear.
your head and you start worrying about it.
Starts raining.
If
I
you
freak
see
out.
and you see somebody go through a kidney stone, that is not
No,
pleasant.
you don't want it.
I passed one on an airplane once.
Oh, you have
that's
a history of kidney stones?
I've had 2.
What the hell isn't wrong with you?
Oh, my gosh.
I'm not pregnant.
Okay.
There you go.
That's good.
Yay.
So what kind of kidney stone was it? Did you save it?
Calcium.
It's calcium.
That was the first one.
Calcium phosphate, calcium oxalate. Do you
I
know?
don't even remember.
Okay. And never again?
I had one more. I didn't save it. I didn't try to go after it on the airplane. It wasn't bad. It was small. I mean, it hurt, but
Oh, yeah, I guarantee it.
I think it was the beer I drank before getting on the airplane that
Oh,
probably
goodness.
helped that little
Did
thing
you?
out.
We were talking last time you two weren't here about the time when I was on an airplane and they said, "Is there a doctor on the airplane?" And I got up and this guy was having chest pain. And it's like, "Well, do you have nitroglycerin? Do you guys have this? Do you have oxygen? All this stuff." And after we got him sort of settled down and laid him down and got his feet up because his blood pressure was low, they said, "What kind of doctor?" I said, "I'm a hospice doctor."
But he felt great.
Oh, my God.
Stupid. All right.
Hey, Dr. Steve. It's Sam from Australia.
Shout
wow.
out. A call from Australia. By the way, my friend, I saw that this guy actually spent money because the area code was started with 61. You can just record it on your phone and email it to me, drsteve202@gmail.com. I'll take it that way.
Okay.
I don't want you spending your hard-earned money on calling this dumb show.
To Shell advice. I'm considering going to Costa Rica to get some mesenchymal stem cell treatment. I've got some old MMA injuries, and I've also got a injury from a burst appendix. So I was just wondering if you think that is a sort of good way about going with things. Anyway, thanks, Dr. Steve. Have a great day.
All right. You got anything on this?
Stem cells?
No, mesenchymal stem
Oh,
cells.
no. But I can look them up.
Well, no, I mean, okay.
No, we're
That's
off
okay.
topic.
But
No,
mesenchymal
I'm sorry.
stem
Yeah.
cells are known as mesenchymal stromal cells.
Mm-hmm.
And they are multipotent cells that they differentiate into a bunch of different cell types. And they can turn themselves into bone, cartilage, muscle cells, fat cells, all kinds of stuff. So the question is, do they seriously not have this anywhere closer to you than Costa Rica? That's a long way to go.
One, and what's he trying to fix with them?
He said something about, what did he say, a ruptured appendix injury?
And some MMA injuries or something like that, maybe.
Yeah. there is some research that's being done on these for making, repairing cell damage. And but I am not up to date on the research, but I'm looking at this, and the term has been debated for years. The use of them has been debated for years. Whose stem cells are they? Are they going to take your own and then treat them and inject them back in?
Yeah.
There's not good data on this. There's a lot of concern about marketing and application of this. Now, do I think that it's going to do him any harm if they use his own stem cells? I think that the amount of harm is minimized, but I just wonder how much good it's going to do.
Well, the younger you are, the healthier your stem cells. Typically, the older, like some of the people that we have to get stem cells, the older you are, the less viable most of the stem cells are. And a lot of times that's when you get donor stem cells.
Right.
But you know what we see is a general rule, someone has to have something there to work with. So it doesn't magically reproduce something that's gone. So if you've got a knee that's completely eroded, or a hip that's got like an avascular necrosis or something like that, you can't put a stem cell in there and make it all of a sudden grow back.
So I'm looking here, mesenchymal stem cell-based therapy for rheumatoid arthritis. This is from the International Journal of Molecular Science. And they said, in the recently investigated mesenchymal stem cell-based therapy is considered a promising approach in rheumatoid arthritis. So, it's not complete horseshit. Here's application of mesenchymal stem cell therapy for aging frailty. So we'll look at that. I'll tell you what, we'll look into this further, and then we'll try to come up with some concrete information about it.
My question would be, what's healthcare like in Costa Rica?
Well, they can do stuff that they can't do other places. We'll talk about
Yeah.
that. Thanks, everyone. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks. So let's finish that conversation here on the podcast side. Okay. All right.
These are these shoes I was talking about. The tennis shoes, the really cool ones. What?
So anyway, this mesenchymal stem cell therapy research, this is from the journal Theranostics, and it says transplantation of MSCs represents a promising therapeutic strategy to address pathophysiologic problems of frail syndrome, in other words, medical frailty. The therapy has undergone phase 1 and phase 2 trials in human subjects that have endorsed the safety and efficacy of mesenchymal stem cells for aging frailty. Caution is still needed with regard to potential to form tumors, and further large-scale studies are warranted to confirm the therapeutic efficacy of mesenchymal stem cell. Mesenchymal
That's a tongue twister.
Stem cell therapy, and that was in 2021. Let's see. Okay, here's one for knee osteoarthritis. Here we go. Injective mesenchymal stem cell-based treatments for knee osteoarthritis from mechanisms of action to current clinical evidence. It says, despite the constant presence of positive and satisfactory results in the studies analyzed, the complexity of MSC metabolism-related therapeutic effects, as well as the weakness of most of the studies, do not allow withdrawing definitive conclusions about the superiority of one tissue source over another, as well as about the best cell dose and long-term durability. So there is some positive data, but they haven't nailed down how to do this the best, or what the dose is, or where to get the cells from, et cetera, et cetera. And that's from Knee Surgical Sports Traumatology and Arthroscopy Journal. So anyway, all right. Yeah.
I've got something to add to that. You know what would be interesting to do, to see if they did a study with the injection of those stem cells and a placebo injection of nothing. because if y'all remember, it's roughly 20 years ago they did a study on knee arthroscopies, and they did this in Houston. They had it was like 20 patients all had. We're going to have a knee arthroscopy for like a minor meniscal tear.
Okay.
And they all knew they were going to be it. 10 of them were going to have the surgery. 10 of them were not. But they all were all put to sleep. They all had the surgical incision made. 10 of them then were sent out. The other 10 had the arthroscopy, and the 10 that did not have the arthroscopy went straight to PT, and they went better. They did better, and they hypothesized that it was because of the needle going in there and stimulating the healing, and they didn't even really need to do this, which is what we see a lot.
I like dry needling.
Which is what we see a lot with any kind of the stuff we do. Needling around joints.
Yeah.
I
thought dry needling was bullshit till it got done to me, and it fixed me right up.
Well, yeah, you don't have to. You don't always, and it's a lot of times they're doing that with trigger points now. They're not always having to use so much of the medicine. A lot of times it's just the needle going into the muscle.
That's crazy.
Or the needle, and it's because the body now it's a red flag. It's like, oh wait, we're supposed to go help here.
Yeah,
and that's kind of what they think.
Yeah,
That'd be interesting about those mesenchymal cells.
Yeah, well, I tore my calf muscle.
Oh yeah, that's right. When you were in rehab.
When I was in I was at Skyterra, jackass.
At least he was listening to me this time.
Fuck off. I was at a wellness retreat, and I tore the first exercise. I tore my soleus muscle. Thank you. And I got a massage, and then I got some physical therapy, and then he did dry needling, and it really fixed me right up. I was able to do everything the whole time. So
wonderful.
Yeah, the last time that happened to me, I was non-weight bearing for days and days and days. Yeah, so I was very impressed with that. Anyway, all right, you got anything from the Fluid family?
Stacy wanted to know about why is it that every new drug that comes out warns about not taking it if you have TB.
Say it again.
Yeah, Stacy was wondering about what is it about tuberculosis that every new drug says don't take it if you have tuberculosis?
I don't think it's every new drug. It's the monoclonal antibodies and immunotherapy and stuff. And
because they don't want tuberculosis to kill you.
Right, tuberculosis
will
stopping,
go crazy if your immune system is lowered.
If you suppress your immune system,
it'll go
ham. Right, your body no longer can fight it off.
Right, because the tubercles are caused by the immune system trying to wall it off.
Yep.
I mean, the immune system's reaction to the Mycobacterium tuberculi or whatever the shit it is. It's been so long since I've dealt with it.
You can have tuberculosis and not be symptomatic because it lies dormant in your body.
That's right. You used to deal with that all the time.
I did. I was the tuberculosis nurse.
Was that right?
Yeah.
Oh, wow.
Okay. Well, tell us all about it then. Did you work with Dr. J.M.?
I did.
Yeah, okay. Yeah, I trained under him.
Oh, cool.
Yeah.
So
I don't want to say his name, but I knew you'd know who I was talking about.
I was the tuberculosis nurse for a while, and so tuberculosis.
It's still a real thing.
Right, it is. It's still around.
They got the consumption, don't you know?
I had lots of patients that I treated. So if you are exposed to tuberculosis, so if we're all sitting in this room here,
right.
One of us has tuberculosis and we're coughing and everything, all of a sudden the other three of us are exposed.
Right.
And we can get tuberculosis. That doesn't mean we're going to get sick. It doesn't mean that we're going to die, nothing like that. It just means that it's now in your body and it lies dormant, kind of like chickenpox and shingles.
Interesting, yeah.
So it lies, lies dormant in your body. And if your immune system becomes compromised, so if you get treatment for other things that lower your immune system, then your body's no longer going to be able to keep that in a dormant state, and the infection then becomes active in your body. And that's when you get sick.
Yeah.
And when you become sick and active, that is when you have to get treatment. So you take antibiotics, and there's like several different kinds and lots of treatment. You got to take B12, I think, B6.
B6, I think.
B6,
I can't remember.
because the treatment will...
The isoniazid.
Yeah.
I haven't dragged that out of my head for 30 years.
That's a long time. And rifampin.
Yep.
I'm trying to remember all the treatment. I can't remember. It's like 5 drugs. 6 drugs, something like that.
I gave mouth to mouth to someone with active tuberculosis when I was a resident. And that was back when we still gave mouth-to-mouth. I remember what room it was in. And I can name it. If I do, I'll really be doxing myself because it's not too many rooms, and the hospitals have this particular room nomenclature. But I remember it like it was yesterday, and they coded, and I was doing mouth-to-mouth, and I never got it. I never tested positive.
Never tested positive?
Nope.
Funny story, I'm allergic to tuberculin, the test.
Oh, really?
Yeah.
So what do they have to do? Just chest x-ray then? Yeah.
So every so often I have a little chest x-ray.
Wow. It doesn't seem like they've made us do PPDs at work in a long time. Why is that?
No, they do a screen for me now. I don't know why.
We used to have to do that every year. We don't do it anymore.
So when I was leaving the health department, one of the things that I'm trying to recall, I think the tuberculin, the TB test, if you do it every year, it becomes not accurate because your body gets exposed to it so many times, and then you just quit. Like, oh, I've had that before, and like your body won't react even if you're positive.
I see.
So even if you've got this in your body, all of a sudden your body doesn't recognize the tuberculin because you've had it every year for 20 years.
Interesting.
Yeah, and it's just not as accurate. So they don't do them as often. They try to limit that test as often as possible, and just, screen you for symptoms. So that was when we were still doing yearly TB tests.
Right.
I couldn't do the TB test, so there was screening all these questions. Have you had night sweats? Do you have an unexplained cough for longer
Can
than
you
6
please
weeks?
stop bullshitting?
Have you been exposed? I'm sorry. Hey, wrap it up. We can turn on that air conditioner.
Okay. All right. That's all he's saying.
Please.
See,
I think it feels good in
I was actually listening, and Scott's just thinking,
Scott's
it's
thinking
hot
it's
in
hot
here.
in here.
Yeah.
Sorry, guys.
I really did.
Sorry,
I have
Lily.
one other question that I wanted to do.
Okay.
If we can, and it's from a friend. It says, "Hey, Dr. Steve, it's Sensei AJ. Hello,
Oh, yeah,
AJ.
AJ. What's up?
I hope y'all are doing well. Miss everyone, and hope to be back in studio for an episode one day. Yeah, but dude, you're welcome anytime. A couple of questions I have. Just never seem to remember to call in when you're doing a live show. It seems to me AJ's forgotten how we do the show. We haven't taken live questions in a long time. First is, what's the difference between a PICC line and an IV? NP, Mel B, you want to take that one? Because I know you've done both.
A PICC line goes in peripherally into your body, and once it gets into your body, then it goes into a central line, into a central vein in your body.
So what does PICC stand for?
You had to ask me that.
It's okay. Peripherally
don't.
inserted central
Central line
catheter. Yes. So, yeah, it's like having a central line, but they can do it in a peripheral vein.
So they start it usually
There's usually
in
a
the arm,
PICC team.
and it usually goes in like the upper arm, and they go in that way, and then the catheter goes all the way through the veins into a central artery.
Correct. So that's the
Because
difference.
they do that because the veins are very fragile, and a lot of medications will just burn them up and blow them up.
Yeah, if you got to do 6 weeks antibiotics, you don't want some little dinky butterfly needle in your hand.
In your hand, no.
You've got to have, but you don't want to always be putting a central line in people either, because there's
So you can leave them in for a long time.
First time I tried to put in a central line, I dropped the person's lung. Of course, I was an intern. Well, we were doing subclavian, which is under the collarbone,
Easy to do.
and you have to do it a certain way. And damned it, I got it in there, but I did an X-ray afterward, and there was air between the lung and the chest wall. So, all right, okay. What's the second question? I've always been curious if you can explain in detail what an aortic dissection is. Yeah, his dad had that. It was rushed to emergency surgery. So,
And he lived?
yeah, I don't know. I don't know if he did or not, to be honest with you. I know his dad died a few years ago. It may have been from aortic dissection, but I thought I had an aortic dissection last night.
Oh, goodness.
Well, I get this
Holy
esophageal.
shit.
That's terrible.
And this is the first you're hearing of it.
No, she heard about it. She's talk about not listening. But anyway, yeah, I'm having lancinating chest pain radiating to my back. Well, can can you just be quiet? I'm trying to sleep.
Oh, well,
I
if
have
I'm asleep, then there's...
Right, that's
Yeah,
right.
that's
I have esophageal spasm, and it causes a really sharp pain. The first time it happened, I'm like, okay, here I
See,
come,
guys.
Martha.
It's
I'm
the big
having
one.
the big one.
It's the big one.
And but I drink cold water and it goes away. So that's not an MI. It's not a myocardial infarction. It's not an aortic dissection. But there are layers to the aorta, and the aorta those layers can split. And when they do, it's that's called an aortic dissection, and it can be chronic or it can be acute and kill you. They can get thrombus in there, and when the clot between the layers of the aorta can then occlude the vessel itself, which are a problem, because you can't pump blood. So all kinds of things.
Mm-hmm.
So did you have something else to say about that? You're looking like you didn't like that explanation.
She's probably
I like
hot.
Well, you're both hot. But, all right, very good. Well, listen, thank you, everyone. I guess we'll get out of here. Thanks to Dr. Scott. Thank you, Tacey. Thank you, NP Mel B. We hope to see you back more often now.
Absolutely.
Now I'm feeling better.
Yeah.
Feel like talking.
Yeah.
Yay.
Well, I think the last time you were here, you did the Navage for
I
the
did.
inventor of the Navage.
And we probably need to mark today's show as the first time I've been here sober.
Hey, it's true.
Oh,
That's true.
what the?
I don't even need tequila today.
Forgot about that.
You get nothing. You lose.
Okay. Anyway. Okay. Well, that's good. So was there a reason for that, or you just have to drive?
I have a cat issue
Okay.
going on.
Oh,
I've got to
okay.
deal with the dead
Yeah,
cat
okay.
in my car.
Yeah, we'll take care of that.
Oh,
We'll
my
talk
goodness.
about that after the show. All right. Thanks to everyone at SiriusXM whose steadfast support of the show has sustained us over the years. Thank you to the Fluid family, including, Stacy Deloach, Darth Nugs, Not Cupcakes, Amanda Davidson. Oh, hello, Amanda. And Mick Ribs and some others I can't see on there. So
Don't
thanks
I
for
know
hanging out with
Stacy
us.
Deloach?
You do?
Mm-hmm.
Yeah.
Just checking.
He's been here
Hey.
when you were here. So don't acknowledge him, because then it's fine. Stacy's a good little feller. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Listen to our podcast at wherever podcasts are found. This thing still says riotcast.com. We are now finally with Studio 71. So you'll hear Dr. Scott's ads and some other stuff. It's going to be, it should be better. We're back on a weekly schedule. It'll be, by God, every week, or I'll eat a bug. So it's going to be a lot better. We're going to be doing video stuff. I did a whole live stream last night, and I tried a new configuration, and none of it went out. So I recorded it, and anyone that had the link could see it and interact with me, but nobody else could see it. And so I started editing it, and I was just going to upload it, and I said, screw it, I'll just do another one tonight and do it right. Anyway, it serves me right. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thanks.
Goodbye, everyone.
Bye.
Now we got to do the opening, and then you guys can get out of here. We'll make it quick. All right. You ready? Mm-hmm.